The next one, arnica montana. Now, arnica is the most common remedy we have for musculoskeletal pains and injuries, especially like from trauma, from an injury, a fall, a bruise, a blow. But what's similar in that state, in the state of when someone might have fever, is that there's this extremeness of the soreness and the aching. So if that's, when someone has a flu, for some people it's their stomach is the worst. For other people it's their head congestion. Other people it's the headache. Other people it's the throat or the cough. In arnica patient, it's going to be the extreme muscle aches with the fever. So it's really, really sore, a lot of pain, and it's going to really be worse from being touched, and they're going to have an aversion to being touched. They're going to back away when you start coming at them. The head and face can be hot with the body and extremities cold, similar to belladonna. Desire to be left alone. Claims to be fine when quite ill. So it's kind of like, when someone has like a head injury and they're like, oh yeah, I'm fine, and then they don't want your help, they don't want to be touched, leave me alone. They get up and then they like just pass out again or fall right back down. So it's that, like, think of that like head injury person who's kind of in shock. They think they're fine, but they're not. They feel like the bed's too hard because it's like that sensitivity to pressure or touch. Spontaneous bruising and purpose, so they'll get bruised in black and blue really easily. That's a sign they need arnica. And they'll hold their chest during the cough because obviously it's a painful cough. The next remedy for Ratrum album is really characterized by a lot of vomiting and diarrhea. So if you don't have that at all, you wouldn't probably even think of this remedy. The patient's really cold, but they have also a thirst for ice cold drinks or ice, which is then just vomited as soon as it's swallowed. So they drink a little bit or have a little ice, and that'll trigger the vomiting. Cold sweat on the forehead and feeling rather weak. So it's really important with perspiration. If someone's sweating, find out, is it a cold perspiration? Is it cold and clammy? Or is it really hot? Because that will absolutely differentiate right there between many different remedies. There's a bad attitude here. Their desire for sour things like lemons, lemonade, things like that. Loquacious delirium with religious mania. You're not going to see this all the time, but if, in more severe cases, you might see this. So loquacious meaning they're talking all the time, they're changing the subject, they're from one topic to another, they're bouncing around, can't get them to shut up. And it can be related to even religious mania, themes of, salvation and hell and heaven and fire and brimstone and all that kind of stuff. We'll hit 2 more remedies and then we'll stop. So one more is Rus toxicodendron. This is a cold or flu after an unusual exertion on a wet, cold day or jumping into a cold lake or river or something like that, getting a chill. Tend to be very stiff and achy, especially in the morning. They tend to be restless, and they must move, which ameliorates. When you see AMEL, that's ameliorates, makes it better. AGGR is aggravates, makes it worse. This is key for Rus tox. Very, very important is they're always worse from that initial moment, from that initial motion. So if they've been sitting for a long time, the act of getting up is very painful. It's like, oh my God, it's like an old person. Oh, that's really bad. And then after they kind of straighten out and take a few steps, maybe they start to loosen up. And if they keep moving, they feel better up to a point. If they move too much, they'll start to feel worse again. But they typically can do a walk for a minute or 2 or 5 or 10 or even 30 or an hour, and they'll feel better. But then they sit down again, they get stiff, and then it hurts again to get back up. So someone like that, their worst time of day is going to be in the morning because they've been still all night. They try to get up in the morning. They're really stiff and achy. So it's kind of a classic kind of case of like an arthritic kind of a patient. Their neck is stiff. They tend to be very, very chilly. If you look at their tongue, there tends to be a red tip at the front of the tongue. They're worse from any kind of cold or dampness. They're better from warmth. They can be thirsty for milk and anxious and weepy. And The other thing about the motion with Rhus-Tox in acute or chronic is that they're restless. So they go to change positions, and while they're changing positions, they're in more pain because they're worse from initial motion. But then after they've changed position, they do feel greatly relieved, much better from it. But then they'll have to move again because after 5, 10, 15, 20 minutes, they'll be stiff and sore again and they'll want to move. So that pattern is very, very characteristic of Rhus-Tox injury. So it's that they're worse from being still too long. They try to move, it hurts while they're changing position, but then they feel much better after having done so, but then they need to do so again. So if you get a patient who's sleeping through the night without tossing and turning, without waking up or anything, it's probably not Rhus-Tox. This is a very restless remedy, one that needs to change position often. There's other remedies that need to change position often, but it doesn't really help them. They don't necessarily feel much better, but they feel that need to keep doing that. Okay, the next remedy is pyrogen or pyrogenium. The pulse is discordant or inverse to the fever. So in other words, their pulse will become lower the higher the fever goes. Typically it's the opposite. And by the way, I mentioned before about fever, when to treat it and when not to, the actual fever itself. So the fever is a sign that the body is trying to fight off an infection or something like that. So if the fever is going up and up and up, it means the body's attempting to do it. We shouldn't interfere with it. But when you give the right remedy, you'll find that the fever will come down and the elevated pulse will come down. And it's not because the remedy is suppressing the fever, it's because the body is doing a better job of fighting it off and doesn't need the fever to be so high. So you do want to see the fever come down. That's a sign, that's a way of monitoring if the remedy you've given is working. You should see the pain come, the symptoms come down, the pain come down, the cough get better, the congestion get better, the discharges get better, the perspiration, all of that, so the fever, the pulse, but specifically and first and foremost, even if other symptoms are worse, if the fever's coming down and the pulse is going down, you know you're on the right track. And that should happen pretty quickly in an acute case. It should happen within seconds or minutes or an hour or two. Otherwise, you're probably not on the right track with the remedy. So with pyrogen, they feel like they must move, even though they're sore, but the movement doesn't help, unlike Rhus-Tox. There's a septic nature there, so there's oftentimes infection. It's a very common remedy given for pelvic inflammatory disease, infections, abscesses, things like that. Foul discharges, pus, things like that. Chills in the back, can be delirium like baptisia. Can feel scattered or like there's all these jumbled or double thoughts, ideas, feelings going on at once. And we're going to stop there. Next time we'll pick up on, we talked about cold and flu prevention to some degree. We'll talk about that a little more next time when we talk about oscillococcinum or oscillo and the remedy influenzinum. And then we'll talk about differentiating bryonia, belladonna, and aconitum in fever, because those are 3 very common remedies from there. And so I think we'll get through all of that next time, and then maybe even move into the next topic. We're going to end up, we'll continue to talk about upper respiratory kinds of infections, coughs, sore throats, and that will pretty much wrap up the whole cold, fever, flu general topic. Okay, any questions before we go? All right, thanks for coming and viewing, and we'll see you next month.